Do you know how much it costs to buy unfractionated heparin injection? 10 rupees, 20 rupees. Low molecular weight heparin will cost, your enoxaparin and all the subcutaneous injections, they cost around 300, 350 rupees. Right? Which one do you want to prefer for your poor patient? Huh? Unfractionated. But unfractionated diet, you don't know whether dosage is sufficient or not, and you need to follow up the patient by doing what? APTT. APTT laboratory cost is how much? 250, 300 rupees. So ultimately, you need to decide, shall I make pharmacist rich or kisko rich? Lab guy rich. You don't want to make lab guy rich, you want to make a pharmacist rich. You are going to use, I mean, for you to remember that APTT is not used for assessment of low molecular weight heparin, is what I am trying to tell you. You should not ideally make anyone rich, because the purpose of becoming doctor is to become rich oneself. Start your own lab, your own pharma. Better you give unfractionated heparin or low molecular weight heparin, you are going to become rich. Okay. So that's the whole story. Okay, doc. So yesterday I was thinking that we will be missing this wonderful evening once we are done with the medicine. But anyway, we are going to, we have some luxury of little time. So you are all welcome freely until your exam. We will have a very good teacher in surgery who will deliver a surgery review, and we also have got Dr. Shailendra who will be reviewing with you some of the parts of medicine and medicine also, and we also are identifying a very good obstetrics teacher. We will give you the names when the session starts. So that's the thing. Now what are the indications for giving heparin? Any thromboembolic episode, atrial fibrillation, very important. And after a vascular bypass grafting, we give the anticoagulation. You can give a low molecular weight heparin for a DVT. You can give an unfractionated heparin if the patient can't afford such a cost. Then you can, then very important, whether you give unfractionated, fractionated, you need to give that pneumatic compression stockings to prevent the post thrombophlebitic syndrome. See what happens if there is a DVT, blood cannot pass up due to the thrombus. That will lead to congestion and vessels lose their competence ultimately, and patient's thrombus resolve, everything is over, but throughout life he need to live with edema and venous claudication, which is a challenge to manage a patient of post thrombophlebitic syndrome after the DVT, is what need to be remembered. Now doctor, you have a patient, stable angina comes to you. What is the treatment? Do you want to give thrombolysis for a simple stable angina? No. If it is a pre-infarction angina or a proven MI, that becomes an indication for thrombolytic therapy. We already discussed now, when do you want to give streptokinase, urokinase, everything in cardiology. So whenever you give, we give 70 to 80 units per kg bolus, and then an infusion of 15 to 18 units per kg per hour of infusion, and ultimately target, that is with unfractionated heparin, a APTT to reach 60 to 90 from the normal value of 35 to 40. That is going to be the goal. If you give a low molecular weight heparin, we can give 5000 units subcutaneously every 12 hours, and APTT monitoring is not required. And whenever you are giving low molecular weight heparin, on what basis you decide the dosage? It is the weight of the patient, which is the parameter based on which the low molecular weight heparin, 60 kg, 90 kg, 100 kg, 120 kg, there is a different calculation based on the weight is what need to be remembered. Now the adverse effects of heparin, as already you know, hit can be there, osteoporosis long term if you use heparin, transient alopecia, rebound hypercoagulability. anything can be the problem. Then what are the contraindications to give heparin? If the patient develops HIT, and very important, severe hypertension if it is there, if you happen to give heparin, patient will go into hemorrhagic stroke, which becomes a complication. And if you want to reverse excess bleeding due to the overdose of heparin, what is the drug you remember? Protamine sulfate is the one which you will basically use, and generally low molecular weight heparin has a very longer half-life compared to that of the standard heparin is what need to be remembered. And another thing you can do with heparin, if there is a bleeding, unfractionated heparin, protamine is one way as a direct antidote taken as heparin. You also can give fresh frozen plasma to replenish all those clotting factors killed by heparin. Then coming to the low molecular weight heparin, what is the buzzword you will remember among the coagulation factors? Factor 10A is the one which is basically inactivated, and it can't be monitored either by PT or ABDD. Then already we discussed about the warfarin, and that completes the story. Actually few more things I have in mind, but I think we are already very late. If possible on Saturday, I wish to finish this also, otherwise in the next life I will become your student, because whenever I come across a tough teacher or a very disgusting teacher in the medical college, I used to think maybe in the last life as his teacher I did not teach him completely. This life he became my teacher. So plasma cell disorders, leukemias and lymphomas, without reviewing them, Hodgkin's, non-Hodgkin's lymphoma, AML, CLL, CML, we are going to review. Hope so on Saturday. Otherwise, anyway, from Monday we will have cardiology. So, where do you find the schedule? Will internet open on this? Okay. Can you type our website address? Fast. onlinembbs.com. Okay. MBBS.com. Okay. Here we have the schedule, doctor. What we do is basically cardiology, neurology, nephrology, rheumatology, hematology, one day hematology in our review session mein, 3 hours mein, fast track. In 3 weeks we finish medicine, 2 weeks will be surgery, 2 weeks will be gynaps, and by that time it will be December 24th, Christmas, and we will say goodbye to you, because from then onwards we will be starting SPM. So that's a plan. If possible, we will try to move pediatrics in place of SPM, pediatrics and orthopedics in place of SPM, so that maybe one more week we can give a quick fast review for all the 5 subjects. Dermatology is how many marks you said? 4 marks. Maybe one day dermatology, so that all 10 conditions we will review. Okay. Thank you, doctor. Good luck.